Hello friends. Nowadays our life has become much different than before. We have adapted many different things like cleaning and washing, cleaning our hands, washing our utensils and materials which has been delivered by the delivery boy, and we are doing it and managing it in some or other way. What is happening when we are cleaning and washing? What kind of thoughts are coming to our mind? Like, we have in our mind that whether I'm doing it rightly, whether my cleaning is enough, whether I am able to do the disinfection properly or not, are my hands dirty or contaminated? And these kind of different doubts and anticipations are coming to our mind. Today, I wanted to say that these kind of doubts and anticipations are very common and normal in this condition. But there is a flip side of it. Some people who are suffering from obsessive compulsive disorder, they are having similar kind of thoughts and doubts. But that is a disorder because these thoughts are intrusive in nature and repetitive. Intrusive means it is not the person's control. So despite of understanding the condition, despite of understanding the irrationality of their behavior, they are unable to control themselves. They are unable to control their thoughts. Obsession is when we are getting those repetitive thoughts, intrusive thoughts. And compulsion is when we are behaving accordingly. Like, for example, we are getting a thought like my hands are dirty or contaminated. This is obsession. And when I am going and washing my hands repeatedly, that is compulsion. So this is a typical disorder which is very common in our culture and in fact worldwide. So what is happening now in general population, most of the people nowadays? Because we are now started thinking in that line, we need to keep ourselves clean to be safe and secure. So all these anticipations and doubts are coming repeatedly in our mind. I'm not saying that we are going to develop OCD after this pandemic is over. No, not that. But definitely it is changing our life, changing our thoughts and changing our behavior. Now, I wanted to discuss or point out few things to get rid of this or to handle this situation in a better way. First, do not collect information from different sources throughout the day. Make sure you are sticking to one or two verified and trusted source of information and taking this information for a very particular period of time throughout the day. Entire day, if you are spending in collecting information, reading those things, watching television and news and all, will not help you. Rather, it will increase this anticipation and anxiety and stress. And if you are continuously doing it, cleaning and washing, and there is no end to it. But we have to restrict ourselves to some extent. So cleaning and washing has got a proper guideline which has been given by the different sources, different authentic, verified, trusted sources. So stick to those guidelines and practice your safety behavior accordingly. Make a checklist that what you are going to clean and wash, how many times, at what time of the day. So that will help you to, you will not miss out anything. And at the same time, if you have doubt that whether I have done it or not, you will go and check your checklist and you will cross-check, you'll understand you have done it or not. Still, if you are not able to control yourselves within this restricted time and based on your checklist, you can take help of any of the family members. You can ask them to point you out that when you are going beyond the limit, beyond the relevance point. There is a thin red line where one side of the line is the normalcy and the other side of the line is abnormal behavior. So we have to be very careful that we should not cross that thin red line and practice the behaviors which are required, not beyond the relevance. And lastly, keep trying with a positive hope that we will be able to come out of this situation soon. Thank you.